Hi, I'm Freddi Hoffmann from McLean, and I'm thrilled to be here today with Barbara Evans and Sarah Safransky, and we're sharing with you a new COPD management program. McLean's new Breathe EV program is designed to really help you stay healthier longer, be able to stay independent longer, however you're being affected by your COPD or a loved one has COPD. So there's a lot of exciting research, a lot of new changes and treatment plans. We're going to make it so non-clinicians can understand it today, we hope. And so first I want to introduce Barbara Evans. Barb is director of our outpatient rehab and home care rehab. Not only is she a physical therapist with an extensive background in physical therapy, she also has a master's degree in cardiac rehab and adult fitness. So this actually is a special passion of Barb's, and as we had a task force look at COPD and work with physicians, she really took the lead because it's something she's seen the effects of physical therapy and occupational therapy in changing the lives of people with the disease so they can enjoy life more. So Barb's going to talk about that. Sarah Safransky has been in home care for, well, I won't tell you how many years because I know she looks much younger than that. But she's really an expert nurse in home care and, again, has been really studying COPD in ways that the nursing team can work together with the physical therapists and the physicians. Keep thinking of triangles today. We have the triangle of the physician, the nurses, and the therapists working with the patient and the family to improve their lifestyle. We also have a triangle they're going to explain to you, which is very interesting, of 3 things that together will change your life, which is oxygen therapy, medications and management of your medications, and physical activity. Together, the 3 of them can make a tremendous difference in the way you live. And so that's what we're going to talk about. So first, Sarah, I said COPD. Now tell people what it is.
Oh, thank you. COPD is actually an acronym that stands for chronic obstructive pulmonary disease. And COPD is becoming increasingly common, unfortunately. The main reason is because it's related most commonly to cigarette smoking. And it has actually become the 4th leading cause of death. More deaths per year than even cancer. And while that sounds really very, very scary, there's actually a lot that can be done in managing the disease as you opened. The GOLD guidelines were published several years back, and they've gone a long way toward educating physicians and other professionals, nurses and therapists, on actually what is the gold standard or the best practices for managing the disease. And it used to be really that doctors would say, well, I'm sorry, you have emphysema or you have COPD, which I'll explain a little more as to what these diseases actually entail. But there's really not much that can be done for you, Mrs. Jones, and you need to just take it easy. And really, we know now that it's not taking it easy, and there really is quite a bit that can be done from a medical management and the patient's involvement. The person who has that diagnosis then needs to take ownership of their disease and actually be an active participant with the doctor.
So you've mentioned emphysema and bronchitis.
The COPD actually is a sort of a condition that's made up of 2 main diseases, and that is chronic bronchitis, which actually is characterized by excessive mucus production in the airways, in the lungs, and that leads to that chronic cough, and that unfortunately it's not nice to talk about, but we're coughing up actually thick sputum. And the other disease is emphysema, which many of us have family members who have had that disease. I know that you have, Freddi. And my own grandmother had emphysema. And emphysema is characterized more by a progressive destruction of the tiny air sacs in the lungs. They're called alveoli. and they lose their elasticity and their ability to function normally, so that the lungs actually get overstretched and just don't work very efficiently. It gets harder to breathe out and to get the air out of the lungs, and therefore it gets harder to move about and to be
Can you
active.
demonstrate that? When you demonstrated it the other day, it made it clear to me.
Yes, actually, if you think about taking a deep breath and then trying to exercise without being able to fully exhale. So and as your pulse rate gets up, your body has more demand for oxygen, and you can't quite ever get enough air. And so you start feeling very short of breath and fatigued. So we'll talk about what can be done to sort of break that cycle and help you to be able to be active, but not feel so short of breath, and know what to do when you do feel short of breath. COPD is usually more chronic bronchitis or more emphysema symptoms, or a combination of the two. People tend to fall somewhere in a continuum.
How is asthma different?
Yeah, that's a good point, Freddi, because asthma is also a chronic disease of the lungs that people deal with, but it tends to be diagnosed at a younger age, for one, and it's a response. It is inflammation, and COPD is inflammation, but it's a response to allergens, specific allergens that trigger a asthmatic response, and the airways constrict suddenly, and it's hard to get the air in, enough air into the lungs. Versus COPD, you typically have more problem getting the air out. It is important to really have a true diagnosis of COPD, and that really has to be done by a doctor and using something called spirometry. And spirometry is a very simple test. It's not painful in any way, but it actually, you breathe out very quickly into a tube, and they measure how much air you can get out in a quick breath versus what's normal. And if it's less than 70% of what's normal, it's considered diagnostic for COPD.
So now you've been diagnosed, you've been to your doctor. That's our first thing, is please go to a doctor, because we need to partner with the doctor, an essential part of that triangle. And so you've been to the doctor, you know you have COPD, you're seeing changes in your lifestyle. So what can we do to start treating?
Well, there's actually quite a lot that can be done to help people with managing the symptoms of COPD and to keep flare-ups or exacerbations from occurring. At McLean's, we're in this unique position of being able to offer services for people in a variety of settings, from either being in the after hospital in our post-acute rehab center, or in our home care center or home care agency, where we can actually, the therapists and nurses go out to see patients, or in our outpatient center, where people can come into our center and can be seen by a physical and occupational therapist to give them instruction and advice and how to manage the disease. So we're very fortunate at McLean's to have such an extensive resource of therapists and nurses to be able to provide this information on the management of the disease.
And you formed a team. I mean, you've got a team of clinicians, both nurses and some pulmonologists, that are working on designing this program.
We work very closely with the physicians. First of all, it's important to have an accurate diagnosis of that you have COPD and what the extent of the disease is. And then there's also the medication management that the physician provides, but we work very closely in collaboration with the physicians and hospitals in our community. We developed the program kind of based on our very successful model for the total joint replacement patients. We have provided the services for people, whether they're in the nursing facility or in the home care setting, or in the outpatient setting. So we've kind of expanded upon that program. All of our staff have got knowledge about COPD and what to do for it. We have a lot of expertise in treating this disease.
So You've been to the doctor, you've been diagnosed, you want to improve your lifestyle, you can't get to the mailbox anymore. So you call up for, your doctor gives you a referral, so what do? You know, what's going to happen in my assessment?
Yeah. When you come in, you'll be evaluated to specifically identify what kind of problems that you have. So we'll look at what your range of motion or flexibility is of your joints. We'll test your strength to see just what your strength is in your arms and your legs. We'll also take a look at your posture. Oftentimes, yes, oftentimes people kind of develop a slouched over posture with the head forward, and it's very difficult to get a full breath when your posture is poor.
Yes.
So one of the first things that we'll work on is trying to work on. We'll work on trying to improve your posture so that you have a little bit more room to even be able to take a full breath. So that's important. We'll also take a look at what your endurance is. One of the problems that occurs with COPD is that because you're short of breath is that you limit how much activity that you get, and then your body gets weaker. And so then you're able to do less, and it just becomes this vicious cycle. So the first thing we want to do is to assess what your endurance is right at the beginning, and we'll do a simple test called the 6-minute walk test, which is just as simple as having you walk for 6 minutes. We'll measure what your vital signs are at the beginning of that 6-minute walk test,
level, right?
which includes taking what your oxygen saturation level is. We'll take your pulse rate and your blood pressure, and then we'll see just how many steps or how many feet that you can walk within 6 minutes. If you're not able to walk 6 minutes, then what we have you do is to walk as far as you can. If you need to take a rest, you sit down and take a rest, and then when you can, you get back up and start walking again. And then we just measure how far that you can walk. So that gives us a good baseline as to how much you can do. You need to be able to walk 6 minutes in order to just get down to your mailbox, perhaps, or to the grocery store for simple little things. So it's a simple test. It really is kind of a gold standard in pulmonary rehab to identify where you are with your functional ability. So we look at what your endurance is, and then we'll develop an exercise program based on what your specific needs are. And that's done by the physical therapist as well as occupational therapy. Occupational therapy will take a look at what your abilities are to do functional activities such as dressing, even bathing, household chores around the house, vacuuming, making the bed. And they've got...
This is conservation of energy. You were explaining that the occupational therapist, one of the key points of the program is to teach you to conserve your energy.